John McDermott is director of the CGIAR Research Program on Agriculture for Nutrition and Health, and I also understand that Rachel has a lot to do with the CGIAR system. So the fact that you work for her shouldn't interfere whatsoever.
I work for him.
Go ahead, John.
Thank you. So I want to look at, we have a lot of practical experience actually on the ground with climate shocks already. They're happening in the Sahel, they're happening in the Horn, they're happening in Bangladesh. So this isn't just a theoretical world out there. And how are those playing out? Well, often the climate shocks to weather variability are correlated with food insecurity shocks, they're correlated with health crises, they're correlated with conflicts. So there's all these things are kind of coming together. And there's quite an intimate relationship with the kind of resilience that we need, with the type of shocks that are happening, and particularly with the health and nutrition of populations. And so kind of how do we look at this? And what we find often is that resilient populations are hard to come by, but it's often health shocks that are hurting households, that are hurting communities, and it's multiple health shocks often that are doing that. And what kind of health shocks are these? Well, they are often the everyday emergencies that happen and pile up on each other. Occasionally we have bigger infectious disease health shocks, which are also important, and they can come through the food system or they can come directly through infectious diseases. So those things are there, and kind of how we integrate those in a way that Rachel was talking about, I think are going to be quite important. Now, obviously from a public health perspective, prevention is always better, but we're not that smart, I'm afraid. So we can think of some kind of preventive measures, but in general it tends to be the responses that we require are much more about general resilience. Okay, so health insurance would be a good thing actually for lots of people. Kind of coping systems for communities, because often the resilience is very context in specific locations. But then more general things in terms of social protection and other things to really help communities to cope. And when we're talking about health and nutrition, we're talking about all kinds of things. We're talking about malnutrition, we're talking about obesity, we're talking about mental health, we're talking about other types of health. So this is really quite a thing we need to think about, because at the end of the day, the people who are going to adapt are people, and these populations really need some support, especially ones undergoing a lot of multiple shocks.
Great.